First, I'd like to say thank you so much for joining us on our November Aging Gracefully with Arthritis webinar. My name's Asia Lee. I'm the Director of Patient Education here at the Foundation, and I'm going to be helping us guide through this webinar. So, just a couple of housekeeping rules. All attendees have been muted. That's simply because it is a lot of you guys, and we want to make sure that we can hear our speakers and it's not distracting. The Q&A function at the bottom of the screen is open though, so you are able to type in your questions as you think of them, and one of our SMEs will likely respond to you. After the presentation, we will have live Q&A. So questions that you submitted when you registered, questions that came up while we're having the presentation, we will be able to get to those if we're not able to type them. And as a reminder, there will be a post-event survey sent to you, so keep an eye out on that. That's how we figure out what type of experts to bring, what type of programming to provide. And you always can find these webinars and more resources on our YouTube page, as well as our arthritis.org/webinars page on our website. But I want to invite you to meet Jane Brandenstein. She is going to be our moderator for tonight. She is a retired physical therapist. She's been volunteering since 1982 with the Arthritis Foundation, and she brings both a professional and patient perspective. I wanted to bring her in specifically because she has an amazing story that she could share, and that will really set the tone for what we're looking to achieve here on this webinar. Jane, could you talk about yourself just a touch?
Sure, sure. So thank you for having me. I'm not sure why I was invited. You can see my hair's kind of white, and I'm only 82, so I'm not sure if I fit in the aging category, but here goes nothing. So, yes, I'm a retired physical therapist. I became a physical therapist back in the day. I'm not going to tell you when we treated arthritis with aspirin because that's all we had. And then we went to prednisone and we went to non-steroidals and the wonderful medications that we have access today. Much of that supported by research that was supported by the Arthritis Foundation and contributions that people have made over the years. So thank you for that and keep it coming. As a physical therapist, back in the day, we told people, well, you have arthritis, you have to rest. You can't do that. You want to run? Are you crazy? And we really tried to get them not to be very active. But some of that research I spoke to has proven that exercise is part of the medication that needs to treat arthritis. Now, I will tell you, being a physical therapist and giving out all those messages, and now to wear those shoes myself, because I do have osteoarthritis and I have gout. Some days it doesn't feel all that good, but it's much better than any alternative I've been able to think about. So, over the years, I've been a volunteer for a long time, looking for ways that people could exercise when they didn't have a gym membership, helping develop videos and teaching tools that people could use at home. Over time, what I am learning is that the medicine is good. The physical therapy medicine is maybe adapt that you can see my hands. I have splints on my thumbs, and you can see my slide says I play the flute. Well, yeah, I do. I play two community bands. And but I have these funky thumbs that are loosey goosey, and I really was having trouble holding the weight of my flute. So what did I do? I said, occupational therapy, they're the people that do that. So I got an appointment with the occupational therapist, and they got me these splints that are lifesavers. I think survival really deals with finding the things that are important to you, things that you really want to do. That's why I'm still playing the flute. Another thing that my husband and I do, we have a sailboat. We've been sailing together for 50 years. And we used to go out in that crazy 30-knot winds and race our sailboat. And we crave that, the sailing. But 30 knots, or no, no, I'm not going out in that. So we have adapted. We always have another person on the boat with us because it makes us safe. But we've adapted so we can still do what we really love to do. I think it's also important that you remain positive. It's so easy to say, "Oh, I better put the flute down. It's not working for me." And I could be real negative about that, but no, we've adapted and now we can continue to do the things that we love. So, one other thing that I make a point of doing first thing in the morning, get my cell phone, open up Facebook, and who's on there like crazy? Snoopy. Snoopy is so stinking smart, I can't stand it. And one of my favorite quotes from Snoopy says, when you are getting frustrated and you're about to say something to that white-haired person who's maybe taking too long to cross the street or is fumbling around at the ATM, before you say something to that older person, put yourself in their shoes. Think how they must feel to be having trouble with things. But many of us have to learn to ask for help. I was shopping the other day and I had to ask a gentleman to reach in the cooler to get me eggs because they were all the way in the back of the cooler. I'd have fallen if I tried to get in that cooler. But to me, asking for help is like calling back favors that you have helped people do little things over the years. Now it's time to call them back.
Oh,
So,
that's beautiful.
to me, the keys of what I just said are be positive, do what you really want to do, but you may just have to adapt to it. So, Aisha, I think that's what I wanted to say. Thank you.
That is the most perfect introduction to this webinar. I want you to know that I feel inspired. And every conversation that I've had with you, I've been able to take it back to my team and say, oh my gosh, Miss Jane is just so lively and she's so exciting. And you make me look forward to aging. So thank you so much for starting off our presentation this way. We'll hear more from Jane in a little bit, but now that you kind of have an idea of what type of presentation this is, I want you to take a second and think about your own situation. Which area feels most challenging for you as an attendee of this webinar? Is it understanding what's happening in your body? Everything is new, everything feels different. Is that the biggest concern? Managing pain and remaining mobile. Sometimes days are harder than the others. How can I still keep moving? Because, as Jane said, That movement is actually what's going to make you feel better. Advocating for myself in healthcare and insurance. It's open enrollment. There's a lot of things happening insurance wise. Do you know all of your rights? Do you know all of the things that are included in your plans? Or is it staying positive and confident, as Jane said? Or is it all of it, right? But no matter what part you're on right now, we have something for all of you in all of these moments right here. So, the key takeaways, the things we hope that once you're done with this presentation, you feel better about. You're able to understand the connection between arthritis and aging because it is a little different than just traditional aging. We want to give you strategies to stay moving and to reduce that pain as much as possible. And we want you to know how to advocate for yourself, how to ask your doctors for things, how to use your community connections and resources. And finally, we hope that you embrace aging. It's not something that is you shouldn't be afraid of it. You should be looking forward to this new chapter. We wanted this whole presentation to feel like a journey. A little bit more resources for you. This is about aging, but we have a plethora of information about all things arthritis on our website, as well as our podcast and Yes Tool, where you can get some exercises. But now we're going to get into the meat of the presentation. Our first expert is Adam Kreitenberg. He is a doctor of rheumatology, but board certified in rheumatology and internal medicine. His focus is diagnosing and treating autoimmune and inflammatory joint diseases. And for a special treat, he serves as the physician formulator for 1MD Nutrition. So we'll hear from him today. And we also have Harwanda Rowel. She's a registered nurse with over 30 years of experience, a background in pediatrics, oncology, and trauma care. So she can speak to the whole suite of what may happen to the person from being a child to maybe aging. And then we have her specifically because she's also supporting her aging parents. So she's right there on the ground, kind of experiencing these things as she also goes through a couple of changes herself. So we really look forward to her coming and bringing us some healthcare and wellness. In addition, we will have Anna Hyde. She's our VP of Advocacy. She's going to come in and close us out with some information about open enrollment and the different changes that are happening with your insurance plan. But as a reminder, this webinar is just for educational purposes. It's not intended to replace any medical advice. Please consult your doctor, your care team before you make any changes. And with that, we're going to pass it over to Dr. Adam Kreitenberg to help us understand arthritis and aging.
Thank you so much, Asia. Thank you, Jane. That story is incredible. We can clearly see your experience and your passion really shines through. And Harwanda, I really can't wait to hear from you as well. So first, I want to thank everybody for being here. This is quite a big crowd. Obviously, this is a very important conversation to be had. As a rheumatologist, I'm a board certified rheumatologist in the Los Angeles area. There's an ever-aging population. And the bottom line is that with an aging population, you're going to be having arthritis symptoms. That comes with soreness, that may come with some with weakness, some loss of function, some loss of independence. But what Jane said is really important, is that we shouldn't necessarily give up. Now, this is an opportunity to really utilize the advances that we have in diagnostics, the advances that we have in treatment, the advances that we have in nutrition and dietary supplements to really optimize those later years and decades. Next slide, please. So the power of aging. And I love the fact that you're using the word power, because really that's what this is. There will be changes that happen in your life as you get older. Again, we talked about more pains, we talked about more weakness, and acknowledging and saying, okay, you know what, I'm older, so these are normal things that are going to happen. Yes, that's okay, but it's important not to be complacent. So yes, acknowledge your feelings and acknowledge your symptoms, but seek out support. And that support may be from a provider and acknowledging what is the underlying problem that you have so you can get on the right treatment course. Adaptation, something that Jan spoke about. So yes, there will be changes in your life, and it's not a matter of just giving up and dealing with it, but you have to actually be proactive and make adaptations in your life, the way that you do things, and also using assistive devices. You may need help to open a jar. You may need help to open a door. You may need a cane or a walker to help, keep you upright, keep you more mobile. So adaptations are incredibly important, and then feeling empowered. Okay, understanding what is important in your life, whether it's playing the flute or whether it's playing pickleball or being athletic in other ways. So understanding what's important to you and focus on what you can do and what you will do, as opposed to focusing on the weaknesses and what you can't do and becoming frustrated. Next slide, please. So the bottom line, aging is different for everybody, but you're not in a boat by yourself. You're in a boat with a whole bunch of other people. The aging process is a natural life process, and this is just another chapter in your life, okay? But with that next chapter in your life comes all of the journey beforehand. It brings wisdom, resilience, perspective, and essentially those are the tools that you will need and the strength that you need to help make those adaptations. So do not stop. Don't focus on what you can't do. Focus on moving forward and what you can do. Next slide. So we're going to start sort of the more medical part of this now, discussing the more common signs of aging that happen with arthritis. And again, a lot of this stuff is normal and a lot of it makes common sense. But it is important once you start feeling this, if something is not feeling right or it's more than you would expect, go see a specialist and make sure that what you're going through is properly diagnosed and then getting the right treatment protocol. Okay. So yes, a lot of us will experience more joint stiffness, especially first thing in the morning. Chronic pain, chronic achiness, sometimes weakness comes with that. Sometimes balance issues comes with that. Swelling and inflammation, that's a whole nother sort of topic and we'll talk about the differences between osteoarthritis, more mechanical arthritis, and inflammatory arthritis. But again, with all that stiffness, with all that pain comes reduced flexibility, reduced mobility, reduced function, and then reduced independence. So again, be proactive about this, be your best support system, but also utilize the other support system around you to make sure that everything is okay. And then bony growths happen. A lot of what we just discussed here is more symptomatic, what stuff that you feel on the inside, but the bony growths are kind of signed from the outside. Sometimes they're just aesthetic for people, but sometimes it's kind of a reminder that, hey, these arthritic changes are happening and they're happening kind of sort of as we speak. So again, seek appropriate medical care when it's necessary. Next slide. So the 5 M's of holistic care, and the M's are basically all surrounding the management of aging. And what I like to talk about first, I don't know if you can see my mouse, but I like to start at 10 o'clock, which is matters most. I think the first thing that you need to do is, in addition to acknowledging that there is a problem, is figuring out what matters most in your life. What are your priorities? What is important to you that you need to strive and adapt to in order to achieve? And then from that, figuring out, again, what medications do you need to be on? I take care of a lot of older people. And when you take care of older people, there are medication lists. Sometimes you're taking 2, 5, 10, or even 15 medications. Make sure the medications that you're taking are the ones that are right for you and not causing actually other problems down the line. Keeping your mind in order. So there are people who have memory issues, cognitive issues. Make sure that you see a doctor to address that. That's definitely part of the aging process. But I also like mind and mindfulness. So it's important to have mindfulness in establishing and be, what's the word I'm looking for? Be mindful and sort of get dedicated and guided and focused on what it is that's important and what treatment plan we're going to be enacting. Mobility is important. We're going to be talking about mobility over and over and over again. Staying active, stretching, flexibility will allow you to be more mobile in the short term, but also in the long term, whether it's years or decades from now. And then multi-complexity. This is, everything that we're talking about here, it's not necessarily straightforward. And there's multiple different sort of facets that are poking themselves into this and causing, issues managing aging, managing arthritic conditions. So it's important to address this from multiple positions: mobility, nutrition, formalized medications, but also utilizing support systems in your life, doctors, friends, family, and whatnot. Next slide, please. So we're going to talk about effective symptom management. But before we talk about effective symptom management, we need to figure out what's going on, right? So I'm a doctor, but most of the people listening may or may not be doctors. And so determining what the best plan of action for your symptoms first requires to get a diagnosis. And so next slide, we're going to break down the different types of arthritis that one may be experiencing and then kind of taking a deeper dive into what it takes to manage those things. So what we see in the middle here is a healthy bone. So a healthy bone, you see the 2 bones that make up the joint space, you see the joint capsule around them, and then you see kind of nice healthy bone and nice healthy cartilage. Now we're going to move over to the left side now. Now on the left side, we see osteoarthritis. And the name osteoarthritis is a little bit of a misnomer because when you see itis at the end, it suggests that there's inflammation going on, but that's not clearly what's going on in osteoarthritis. Osteoarthritis is a more degenerative, mechanical sort of wear and tear type of arthritis that is heavily associated with age and occurs over time. Now, we'll talk in the next slide about sort of the risk factors for osteoarthritis, but in general, what we're seeing here is a wear and tear degeneration of the joint. You get degeneration of the cartilage, which lines the joint, and then you get sort of reactive bone changes with bone spurs. We get cracking of the bone, and then there is maybe a slight inflammatory process to it that can cause some swelling. On the right side, we see inflammatory arthritis, and as a rheumatologist, this is kind of my wheelhouse. When patients come to my office and they're experiencing joint pain, one of the first things that we need to figure out is, are they experiencing kind of more mechanical wear and tear joint pain, or is this more of an inflammatory joint pain? And the inflammatory joint pain examples are things like rheumatoid arthritis, psoriatic arthritis, lupus, ankylosing spondylitis. And where this differs is that this actually involves the immune system. And the immune system, which is normally there to keep you safe in your environment, well, it's not working properly, and you're creating inflammation that gets targeted at your joints, and you have a whole litany of symptoms that goes along with that. That happens typically in a slightly younger population, but as you age, there is an increased incidence as well. Next slide, please. So a deeper dive into osteoarthritis. What are some of the risk factors that we see? So aging. Okay, we don't see too much osteoarthritis in younger populations unless something has happened. If you have a genetic predisposition, you may see it a little bit sooner. Obesity, so all the force that you're putting on those weight-bearing joints, being obese, definitely can take a toll on joints. Prior injury, so I see a lot of people who 15, 20, 30 years ago were skiing, had a fall, injured their meniscus, injured their ACL, had surgery. And a lot of these people are at increased risk for having a more accelerated arthritic osteoarthritis in the future. And then repetitive joint stress. So repetitive joint stress is an interesting one because you would think that people who are marathon runners will typically have a lot more osteoarthritis. That's not necessarily the case, but it's typically the repetitive joint stress when there's a lack of proper alignment and orientation for the joint. And you can put extra stresses where they're not supposed to be, and then you can get issues down the line. But what we see here, sort of from left moving to right, you can see kind of mild arthritis all the way to severe arthritis. And what we talked about before, degeneration of the cartilage, narrowing of the joint space, kind of bone cysts and bone spur formation. Next slide, please. And here's the inflammatory arthritis. So this is the one that involves the immune system, where the immune system is creating inflammation that gets targeted at your joints. We talked about some examples of those, including rheumatoid arthritis. This works a little bit differently. Again, you definitely need to see a provider. You cannot rely on yourself to diagnose this, as many people can for osteoarthritis. You need a rheumatologist specialist to diagnose this. Sometimes it takes blood tests, sometimes it takes x-rays, sometimes a combination of multiple different diagnostic techniques. But this is definitely treated in a different way. There are actually disease-modifying medications, which we'll get to a little bit further in a couple slides. But it's important to note that, again, when the immune system is involved, it's not just inflammation in the joints, it's also systemic inflammation affecting other areas of your body, even your heart and lungs. Next slide. Okay, so now we're going to jump into those treatment options, which I kind of teased before. And we're talking about treatment options. There is no one size fits all. That's the bottom line. And so you need to be proactive in talking to your provider and not only deciding what all the potential treatment options are, but also figuring out what is good for you and you specifically. You need to talk to your doctor. What are my priorities? And then discuss it in those terms so that we can optimize your overall joint health in the next years and decades to come. Next slide, please. So medical options. So we're on the left side, this time is inflammatory arthritis, and the right side is the osteoarthritis. We'll start left to right. Inflammatory arthritis, I mentioned that there are specific medications that you need disease-modifying medications. So there are immune system targeting medications. Some of you may have heard of these before, some may have not, but they're sort of in the general term of DMARDs, or disease-modifying anti-rheumatic drugs. And these modify the immune system, sometimes actually lowering the immune system. So there's quite a number of side effects that we can see. But the bottom line is that we're not only treating the signs and symptoms, so the pain, the swelling, and the stiffness in your joints, but the utilization of these medications is imperative because it also helps prevent the long-term damage to your joints from that inflammation, which can lead to bony changes, joint changes, erosions of the joints, deformities, and then eventually disability. When it comes to osteoarthritis, Jan talked about all the clinical studies that have been going on and all the focus that Arthritis Foundation is doing, but we still don't have any what we call disease-modifying medications to help to halt the progression of osteoarthritis. So most of the symptoms and most of the treatment options that we're focusing on revolve around pain relief, okay, joint supportive therapies. Me in my practice, I always have discussions with my patients about sort of starting in a more conservative way, physical therapy, exercise, nutrition, then including potentially oral medications that are necessary, maybe topical medications, patches, and then if still we're refractory to those, then we can move up to injections. And eventually what we're trying to avoid, if possible, is sort of joint replacement surgeries, but lo and behold, for some people, those are necessary. Next slide, please. So I very much believe in the power of nutrition. And, unfortunately, in an aging population, appetites are not always great. We don't always have the best access or resources to get the most nutritious food. And so when nutrition or your diet is lagging, the utilization of vitamins and dietary supplements is incredibly important. I'm not necessarily going to go through every single one of these. I'm kind of going to pick and choose. But what I sort of try to focus on is getting a well-balanced diet. And we'll talk about what a well-balanced diet is. But including vitamins and minerals, I want to focus on vitamin D and calcium, very important not only for joint and muscle health, but also really important for bone health. The FDA has shown that adequate levels of calcium and vitamin D in supplement form may reduce the risk of osteoporosis. We also know that adequate supplementation may reduce risk for falls. Things like collagen are important building blocks for our bones, for our joints, for our muscles. The rest of the stuff, creatine, NAD boosters, omega-3s, coenzyme Q10, really, really potent and really, really strong antioxidants. We know that our body creates inflammation naturally. We have reactive oxygen species. A lot of these supplements, whether you're getting it from actual supplement itself or whether you're getting it from diet and food, help with cell regeneration, help decrease systemic inflammation, help cell energy production, and overall decrease inflammation and potentially help in an aging person in multiple different ways, not just joint health and not just bone health, but systemic health, cardiovascular health, and all that. Next slide. So this is a good sort of summary on focusing on what we can do as aging individuals in adapting our lifestyle to optimize our bone and joint health. So we'll start on the left and move to the right, maintenance of healthy weight. So being overweight is an independent risk factor for having osteoarthritis and osteoarthritis-related pain. We know that for every 5 pounds of weight that you lose, it actually reduces the force on your weight-bearing joints by 20 pounds. So it's a fourfold increase in force on those joints for every pound that you increase. So by reducing 5 pounds in body weight, 20 pounds less of force on your knees. Maintaining regular physical activity. So whether that's waking up first thing in the morning and start doing your stretching in bed, or whether that's Tai Chi or yoga or Pilates or weight-bearing exercise, staying mobile, staying flexible is a winning recipe in later years. Adapting an anti-inflammatory diet. We'll talk about diet a little bit more, but anti-inflammatory diet for me is very similar to the Mediterranean diet. And I discuss this with almost all of my patients that I see, focusing on fresh fruits and vegetables, green leafy vegetables, nuts, berries, staying away from red meat and alcohol, which can be pro-inflammatory, processed sugar, also something to avoid. And then when it does come to protein, usually lean proteins, and then sometimes fatty fishes are good, things like mackerel, things like salmon that are rich in omega-3s, antioxidants. Important to prioritize rest and sleep. How is our body going to regenerate itself if you don't get the adequate sleep? It helps your bones, it helps your muscles, it helps your joints, and it helps your brain. And then utilizing assisted devices. We talked about this a little bit previously. Again, if there's a device that will optimize your quality of life, don't be a hero, just get one and just use it. Whether it's opening a door, opening a jar, using a cane, using a walker to prevent you from falling, work with a provider, work with a nutritionist, work with your rheumatologist to develop a care plan that best fits your priorities and your needs. Next slide. Okay, so how do we stay active in daily life? Let's move forward. These are not the only three, but these are the three things that in the time that I have with a patient in front of me, the things that I discuss. So we'll talk again, left to right, cardiovascular exercise. It's just moving, 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 moving. it gets your heart pumping, it gets your blood flowing. And for systemic health, we need to maintain good cardiovascular exercise. Strength training is important. Strength training, you think about strength training, we're improving our muscle strength, but it's actually not just improving muscle strength because muscles are the supporting structures around our joints. So we're strengthening our muscles, we're strengthening our joints, but more than that, we're actually, with weight-bearing exercise, strengthening our bones as well. Our bones need impact. They need resistance on them to stay healthy and rebuild new bone. Strength training helps with that. And then one of the most important for my older patients is balance and flexibility. Stretching, remaining flexible, not getting weak, and maintaining balance, because we all know that a fall can result in devastating joint disease, can result in a fracture of a bone, and maintaining proper flexibility and balance is of the utmost important in an aging population. Next slide, please. So ask Dr. Kreitenberg, I know that I should be active, but how much activity do I really need? And this is a great question because this is not easy. You know, the way that we've created our society, there's a lot of sedentary activity that we're doing, whether it's sitting on a computer, sitting on an iPad, whether it's watching TV. We've become accustomed to sitting around a lot. And so being active is incredibly important. And there's major, major health benefits associated with physical activity, especially for those adults that are 65 and older. And what's important to notice that it's never too late. You may have been sedentary up until 65. You can now become active. Now, I would use a sort of graded exercise program where you're working your way up to develop, a longer level of activity, a more strenuous activity, more weight-bearing exercise. But, an example of starting off, 30-minute daily exercise, 10 minutes of walking, 10 minutes of light chores, and then some chair exercises. And there's major and both immediate and long-term effects associated with exercise. Number one, in the immediate sense, you're improving your energy, you're improving your mood, you're decreasing stress, your sleep will be better. Long-term, lower risk of chronic diseases. You'll have better strength in your muscles, the supporting structures around your joints, better joint symptoms, and better bone symptoms. So overall, major, major effects of physical activity and physical exercise. Next slide. So nutrition, bone health, and fall prevention. We'll talk about nutrition first. I've kind of been teeing this up and segueing for a while with this one. Why don't we go to the next slide? So you are what you eat. Okay, we've heard of that over and over and over and over again, but really nutrition does have major impacts on inflammation in your body, overall well-being, and your arthritis symptoms. Okay, so we want to choose, again, an anti-inflammatory diet, and what we're not getting in our diet, you may need to replace with dietary supplements. What we're trying to do is reduce inflammation, and in reducing inflammation, we're hopefully reducing joint pain as well. It's important to potentially, if you're not getting the proper nutrition, is to see a nutritionist and figure out what does work and what doesn't work for you. Because there are people who are very sensitive to certain things, sensitive to dairy, sensitive to gluten, sensitive to, whatever it is that you're sensitive to. And so we want to choose the right foods and avoid the wrong foods. The first thing that I always mention for people, which is potentially the hardest for them, unfortunately, is refined sugars and then empty calories. Again, we want to tailor our diet to help support our muscles, our bones, our cartilage health. We want a good diet will help with weight management, boost energy, reduce stress, improve mood, and then overall improve quality of life. Next slide, please. Okay, so everybody remembers probably, I don't even know when it was, maybe 5 or 10 years ago, we had sort of that pyramid. And on the bottom of the pyramid was like 6 to 8, I don't know, servings of grains and carbs a day. Well, things kind of, after a while, I think they flipped the pyramid for a while. And now, so this is what the USDA is kind of recommending as far as a daily food guide. So you have the plate. You can forget the fork on the side. So you have the plate. And then on the left side of the plate, you have fresh fruits and vegetables. Again, we always talk about having a colorful diet, all right? So fresh fruits and vegetables are the best way to do that. They're chocked full of essential nutrients and minerals. So that should be half of your plate. The other half is going to end up being protein and grains. We want to focus on whole grains, okay? So those are going to be the best and most powerful energy sources that we have. And then protein, typically lean protein is a little bit better than fatty protein. And then a side of dairy is usually helpful. All of this is aimed to reduce inflammation and support long-term health and reduce the risk of chronic disease. Next slide. So next slide. So we're going to talk about bone health. One of the hats that I have as a rheumatologist is taking care of joint symptoms. The other hat that I have is taking care of bones. Okay. And we know that with an aging population, not only do we see arthritis, but we also see aging bones. And with aging bones, we get decreases in bone mineral density. And what do we call decreases in bone mineral density? We call it first osteopenia, which is kind of in between normal and osteoporosis. And then once you go off the edge, then you're talking about actual osteoporosis. But what does that even mean? What it means is that your bone mineral density is progressively reduced. You're getting, you can see, a more full bone versus more of like a Swiss cheese kind of bone. It means that your bones are getting weaker. And what does that translate into? That translates into increased risk for fracture. And the tricky part is this is a silent disease. We don't feel osteoporosis. You don't feel your bone density getting weaker. What you do feel is that fall and that fracture. So it's important to get regular screening, which is in the form of a bone density scan. It measures your bone mineral density and it gives you a T-score. And that T-score is basically a representation of your overall risk in a statistical model of having a fracture from your bone density that you have currently to what it was in your ideal bone density when you were maybe at 30 or your early 30s. So typical recommendations is to get a bone density scan for women at 65 and older, men 70 and older, but there's a lot of people who do it sooner if you have certain risk factors like certain medications, sedentary lifestyle, genetics, or maybe you already had a fall and a fracture. Next slide, please. So how do we manage osteoporosis? So before we jump into medications, which are listed here, we're going to talk about proper nutrition, okay? Nutrition and dietary supplements. The very thing that I recommend most frequently is calcium. So calcium is a building block for our bone, but also vitamin D. The addition of vitamin D actually helps to absorb calcium into your system better. And then the addition of vitamin K2 on top of that actually helps to take the calcium that we absorbed and move it to the right place where it needs to go into your bones. Okay. And so we're trying to prevent our bones from becoming more porous. And more than that, we're also trying to prevent fractures. And so there's different types of medications. I usually typically break down to my patients the two types of medications that we're considering. Number one is sort of maintenance medications, which we call anti-resorptive. So these medications will help maintain your bone density, prevent it from getting worse, and then also help preventing fractures. And then there's anabolic medications, which are actually bone building medications. One might think, well, why don't I just put everybody on a bone building medication? Well, everybody's situation is slightly different, and that's why it's important to see a rheumatologist or other osteoporosis specialist to determine what's right for you. Next slide. So fall prevention. So we talked about fractures quite a bit in the last couple slides. What is the biggest risk factor for having a fracture? Well, it's having that fall. Okay. And we're not talking about a fracture because you were hit by a car. Everyone's going to fracture something that way. It's more about having a fragility or low impact fracture. So how do we prevent fractures in our older population? So it's making sure that your home is safe. So making sure that you don't have any loose rugs, making sure that you don't have anything that you can trip over, making sure that your hearing and your vision is good, reviewing your medications with your doctor. I cannot tell you how important that is. A lot of older people are on blood pressure medication, multiple blood pressure medications that potentially can low blood pressure and make you more dizzy. And so making sure that you're only on the medications that are absolutely necessary and then staying active, focusing on leg strengthening, focusing on stretching, flexibility, mobility, and then balance therapy is, all is basically an amalgamation of all of that. Next slide. So what do you do if you fall? Okay, so everyone really should have something like this blazered into their mind. So because lo and behold, most people will likely have a fall at some point. So importantly, after you do have your fall, just stay calm and assess your overall situation. Did you lose consciousness? Did you not lose consciousness? What happened right before you had that fall? Are you bleeding? How much pain are you in? Are you able to move? Okay. If you've done that assessment, you want to wait a couple minutes, make sure that you're not hurt. You can roll onto your side, crawl over to a sturdy piece of furniture and then slowly get up. If you are hurt, that's when you should immediately call for help. This could be something serious. You may have an alert system around your, on a necklace, phone, shouting. Make yourself comfortable while somebody's coming to help you. And then once you've had a fall, please, 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 I can't tell you how often my patients will have a fall and then not seek appropriate medical care. But you need to tell a doctor, even if you're fine, especially if you've had head trauma. Next slide. So there are multiple ways to test how strong your legs are and what your overall level of balance is. One way that people do it is trying to get up and down from a chair without using your hands. Another one is a static balance test where you are basically measuring your balance on a single leg. So you'll stand near a chair or other piece of furniture with your hand on it. You'll lift one leg off the floor. And once you're steady, remove that hand and see how long you can balance on that one leg. We're really shooting for about 25 to 30 seconds. And that's something that if you cannot achieve that 25, 30 seconds, something that you should and can work on to improve. Next slide. So adaptations. That's basically been the summary of all of this. This has been the main theme, is that there are normal things that will happen over the course of this aging process. You will likely experiencing some pains. You will likely experience some loss of function because of weakness, because of that pain, and that can lead to lack of independence. So if there's something that's important to you, identify what that is and make the proper adaptations to manage these physical changes as you get older. Next slide. Okay. And so this is just a great summary slide. So again, this is not necessarily things that you should do in order, but these are things that should be done, and pretty much all of them should be done. You can focus on what's important to you and what deficiencies that you have, but low impact exercise is important, sort of working your way up into a higher impact exercise and getting some resistance training. So doing those exercises in a pool adds for additional resistance. Tai Chi, Pilates, yoga, chair exercises, all really, really important. Just make sure that you are staying active. Adaptive tools, we talked about what those can be. Vitamins, supplements, proper nutrition, very, very important. Managing pain. So we didn't talk about that too much, but when it comes to most of the people who are listening to this are likely having osteoarthritis, and that's about managing pain relief. So it's not only a matter of doing physical therapy. It's not only a matter of complementary treatments like acupuncture or seeing a chiropractor. But at some point, people will likely need to use some sort of pharmaceutical agent, which could be just regular over-the-counter or pain medications like oral analgesics, things like Tylenol and ibuprofen, or topical medications. And if still there is a refractory nature to your symptoms, going to see the doctor, establishing the right diagnosis, you may need an injection or, surgery if things continue on. Creating a safe home environment. It's very difficult to do this on your own. That's the bottom line. It's, utilize help from support from a family, from a friend or just somebody who's knowledgeable in creating a safe home environment. We talk about rugs here. Rugs are a hazard. Loose rugs can bunch up. You can trip over that, or a loose rug you can slip on. And so again, what we're trying to do is prevent falls and then seek support. Again, there's a lot of people out there for you. You are not the only person who's experiencing these symptoms. You may think you're alone in this world. There are adult daycares, there are family members that can help, there's friends. Seeking the support that you need will make all the difference in the world and allows you to feel more empowered about the situation that you're in. Next slide, please. And if you guys didn't hear enough from me, this is essentially my last slide. So Asia mentioned already that not only am I a board certified rheumatologist, I'm a physician formulator with 1MD Nutrition. And I mentioned before that I strongly believe in the power of nutrition. And a lot of the stuff that can help you is something that you can get from your diet, but there's a lot of deficiencies in our diets, unfortunately, with the Western diet. And that's where, joint supplements and bone supplements come in. This is a list of supplements that I worked to create and actually have partnerships with the Arthritis Foundation. What's special about these supplements compared to others is that they all have a good manufacturing practice stamp. They are all third-party tested, and they're including ingredients that are clinically studied. So we're using the clinically studied ingredients at the clinically studied dose to optimize the response that you will be having for both your joints and your bones. We need to treat people in the most holistic way possible. So we talked about activity, we talked about nutrition, we talked about formal pharmaceutical treatments, but also utilizing joint and bone supplements is incredibly important. You guys, on the right side is a QR code that you can take a snapshot of, and it will take you to the 1MD Nutrition website, my homepage, specifically with information about all of these supplements. Thank you.
Thank you so much, Dr. Kreitenberg, for that wonderful information. He was able to spend time to talk about what's happening on the inside of our bodies. So we are now going to figure out what's happening in our souls and our spirits. So this particular session will part of the presentation will talk about togetherness, the importance of social connections for seniors. We do know, hey, if your body is good on the inside, that's fantastic. But the second part is the mental aspect. So take it away, Rwanda.
Thank you, Asia, and thank you to Adam and to Jane as they shared information before. You're going to see and hear a lot of what you have previously heard, which really tells you that everything that we're saying, it really is a matter of being connected. As we are moving through these slides that you're going to see, and as you hear me talk to you about the different aspects, you'll hear a lot of the same thing being repeated. So we're going to talk about together. I can give you a little introduction of myself. My name is Harwanda Rowel. I am the proud daughter of Harold and Frida Hancock, 87 and 82. I am a sister, an auntie, a grandmother, and the proud mother of an angel that gained her wings 3 years ago. And so I have made it my point and my mission to make sure that I am there not only for my parents, but for other aging individuals that are in my life, my other family members, aunts and uncles, because not only are they aging, I'm aging at the same time. I was living in Texas, Houston, Texas, for about 25 years, and my father had a stroke in 2021. My sister, who lives in Virginia, was the one who was really taking care of my parents, taking them to doctor's appointments, taking them to different family gatherings. Whenever there was a problem, she was the one that was at the house to help rectify it. And I felt really bad, actually, because my sister wasn't the only child that my parents had. And I felt an obligation to be there to help support. I was very fortunate that I was able to relocate to the Northern Virginia area, which is right outside of Washington, D.C. And I have been here now for a little over a year. And by being here, this has been a blessing to all of us. I've been able to support my sister in taking care of my parents. I've been able to be there for my parents independently, being there for my dad, being there for my mom, and then being there for the two of them together. So as I go through my slides, you will hear again a lot of what my experience has been. You will also hear a lot of what has already been shared. I am a nurse by trade. My specialty is pediatrics. Subspecialty was oncology along with trauma. I have migrated from hands-on nursing to working with the insurance companies at this point. But that doesn't take away my knowledge and my understanding and my love for hands-on nursing. So we can go ahead and move forward, and we'll talk a little bit about the importance of social connections. And you'll see here, the main thing is the healthy socialization. I know that when I got here in Northern Virginia, one of the things that I had to really instill in my parents was that they really needed to socialize. You get to a point where you kind of stay in your own surroundings and you're very familiar with each other, or you're familiar with those that are in your circle. But sometimes you need to go outside of your circle. Sometimes you need to be able to do those things that aren't necessarily familiar to you, just to be able to just to be able to exercise all of the things that you would normally do. And by doing these things and by being in a surrounding that you are being very social, you'll see that it has a lot of health benefits. You'll see on the slide deck here the healthy socialization in the middle, and then you'll see how it branches off to all of the other positive things that come out of it. Well, whenever you're socializing, whenever you're active, it's always going to have a positive outcome on your health. Helps to lower your blood pressure, helps you with your cognitive abilities, helps you when you're talking about your mental health conditions and recovery after falls and injuries. It is essential that you continue with all of your socialization. And that is something that I've had to be very strategic with my parents. I've had to share with them that you need to go, you need to socialize. You need to socialize with not only your friends, but you have a community that you can socialize with. You can socialize with your family, not only with your family. For those of you that are individuals of faith, you can socialize within your faith circle. There are different clubs, there are different societies that will allow you to be able to be a part of it. And by doing that, they will not only support you, but they'll be there to be part of your community. As I stated before, the benefit of the connectiveness, you see here that you have the social bonds and it talks about the aging. When you have the ability to be around your family and be around your friends, you are socializing, just as we just said, and that helps you be a part. You continue to grow. As we are moving forward in this day and age, and as things start to move forward in AI, the need to be able to be familiar with some of the things that you may not have been familiar with before becomes more and more important. And that's something that I deal with on a constant basis, trying to get my parents to be, should I say, active on a consistent basis on dealing with the internet. Some people feel comfortable, some people don't. But that is something that we have to be able to do and that we need to do as we move forward because as we age, we get set in our ways sometimes. But nothing is staying the same. So you have to continue to be able to move forward. You have to be able to continue to stay into those social groups. You need to continue to connect. And by doing that, you will see that community gives you an identity, it gives you a meaning, it gives you support, it gives you security, it gives you purpose, safety, love, and connection. And some of those things are things that Adam just spoke about. And also, some of those things are things that Jane also spoke about earlier as she was doing her introduction. As we move forward into the next slide, we'll be able to talk a little further into some of the other areas, ways that we can build our community. So, as I stated before, you've got your local senior centers. You've got different hobbies, interest groups, community events, volunteering. Sometimes it's not as easy as it seems. And of course, it's always easier from the outside looking in. But being connected is the one thing that's going to help you. Being connected and being active. You have to always remember that there's always someone there that's willing to help you out, but you have to let them know that you need the help. Just like I said before, and I think Adam mentioned it, you can let your doctors know different things that are challenges for you. There's so many support systems that are out there that are willing to help you. Some resources that I never even knew of. I found out by just helping my parents out, I found out that in their county, that the county would come in and they would put up handicap accessible things for them throughout the house at no charge. I had no idea whatsoever. They came and changed their storm door for them. I had no idea that they would do that either. Again, it was something that was done through the county and it was done through their aging department. But again, it's something that people who want to help you, they're there. You just need to stay active and stay a part of the community. If you have family, if you have friends, let them know what you need. They may just come right out and ask you, and they may not. But there's a community for you, and you should never feel like you're alone. Because again, when you go out and when you're active and when you're moving, you're starting to basically interact with other individuals that are just like you, that are able to give you information that will help you. Because it's important for you to keep your own identity. I moved back to the Northern Virginia area, but I moved back into my own home. I did not move back in with my parents. They would have loved for me to do that, but they needed to keep their independence. That is something that is very important so that they can continue doing things that they normally would do. My father had a stroke in 2021, so there are some limitations for him, but not many. My mother, she's taking care of him. She's very, very much involved in his care. She's very much involved, and she is a dictator of everything that goes on in our family. So she is the one that organizes. She is the one that lets us know what we will be doing and what we will not be doing. She is the one that I have to tell all the time, now don't forget to do this. so that you can stay involved. You need to do this for yourself, just as you're doing this for daddy. You need to do this for you as well. It's important that you continue to be an advocate when you're going out and you're volunteering. You bring so much knowledge and you bring so much wisdom to a lot of us. You have the life experiences that some of us have never experienced. And we can grow, we can learn from you, and we appreciate you and we value your knowledge. As we move forward, you'll see here, one of the things that I think is very, very important, and I just mentioned it, is that we stay independent. You have to stay independent. You have to be able to manage your own health and your own daily routines. You have to be able to adapt to change and do that with confidence. And that doesn't mean that it's going to be easy, like I stated before. It just means that you are going to be the owner of yourself. No one else can do you better than you. No one else knows you better than you. You just need to be able to stay involved in your care. Don't throw in the towel. Stay involved. Keep yourself active. Make sure that you're doing all the things that you want to do. Make sure that you are communicating anything that you notice that could be a challenge or something that could be different than what your normal status would be. Then with that status, then you need to be able to take that and share that with your providers. You need to share that with other individuals who come around you, whether it be family, whether it be friends, because usually if you're experiencing something, someone else is experiencing that as well. And it's important that you communicate it so that you can get the assistance that you would need so that you can move forward and you can feel confident. And that's the thing. You have to be confident in that which you need to do. And I believe that we can all do this. We need support. We all need support. But you have to be able to be confident in managing your health, your wellness, your daily routines, and staying involved. That's key. As I just stated, building confidence, that's something that it's more challenging for some than it is for others. But again, if you take it one step at a time, you'll find that it's easier. If you stay involved, you'll find that it's easier. Celebrate every win, no matter how big, no matter how small. Celebrate every win. And you want to focus on your strength. You want to focus on the things that you're able to accomplish. You want to be able to share those things with your peers. Be able to share that you were able to do something, because whatever you're able to do, and when you're sharing it, usually it's going to encourage someone else. And they're going to need to do that. Just like the slide says, learn from your peers. If they can do it, so can I. And that is so true. It takes a community. It takes a community. I can't say that more and more and more. I can't say it enough. It takes a community to be able to be successful, but you are the owner of you. Final words that I'd like to share with you, and I've already shared, you'll see on this slide, and I think it's very important. Here on this slide here, you see a community. You need to have connection. Connections are everything. Wherever you find peace, wherever you find your purpose, that is where you need to connect. If you find that in your neighborhood, HOAs, social clubs, in your church, with your family, you need to find that connection and you need to move forward with that connection, because that's what's going to help you continue to be you. Thank you for the opportunity. I hope I was able to encourage you, to share some things with you. I am here to support and help if there are any questions that you may have later. Thank you.
That was fantastic. What we do know, as she said, the more that you involve yourself in your community, the more positive you may feel. If you feel good, you may look good, you may be able to perform better. It's all encompassing. So thank you so much, Rwanda, for your commentary. Now we are going to transition over to advocacy. You know how to take care of your insides, you know how to take care of your brain. Now let's figure out how to advocate for ourselves with everything that we know. So I'd like to bring on Anna Hyde, my colleague here at the Arthritis Foundation. She's our VP of Advocacy. Go ahead, Anna.
Hi, everybody. Thanks for having me. Those are really hard acts to follow. And interestingly, I had a very similar geographic trajectory. I grew up in Houston and now I live in Southern Maryland. So that's kind of a funny coincidence there. Okay, so next slide. I am going to just speak with you for a few minutes about a particular part of advocacy that's really important right now. So, advocacy, I consider advocacy to be a catch-all word to mean anything. It can be everything from advocating for yourself in your physician's office and feeling like you're really being served properly, and those things. And it could be what you might more traditionally think of as advocating with your member of Congress about a particular issue. We do all of that. But one thing that I think is really important this time of year is open enrollment and navigating insurance. We know that navigating insurance is incredibly complex. We've certainly heard how difficult it is, and we know how difficult it can be to navigate Medicare in particular. So I just wanted to kind of walk through some of the resources that we have on our website, and you can certainly spend some time. I encourage you to spend some time on our website navigating these on your own, and perhaps as follow-up, we can send links. But we have an entire toolkit that walks through kind of a soup to nuts approach around insurance and how to navigate open enrollment generally. So it starts with how do you even choose the right health plan, all the way through to, okay, now you're covered, you have insurance, but maybe you're experiencing some difficulties, you're having care denied. How do you file an appeal and things like that? So this is just, I highlighted a handful here that I thought might be most helpful, solving your insurance puzzle. We also have a suite of former podcasts, webinars, and other things that sort of get into the secret language you almost need to know in order to sort of navigate, the insurance kind of landscape. So I definitely encourage you to seek some of those out. But here are just a handful that could be helpful. We also have them sort of listed specifically by type of insurance. So there are some, if you are on Medicare, that are relevant to you. Exchange plans, Medicaid, commercial insurance. We try to break it up since there are, of course, differences in how they're regulated. Next slide. All right, so open enrollment specifically. Here are some resources just about this, which we're promoting very heavily right now because it is open enrollment time. Medicare open enrollment is ongoing as we speak. It's only open for a few more weeks. And I'm sure that many of you are intimately familiar with the process of going through Medicare open enrollment. But we have, I wanted to kind of break this up into two pieces. One is what are our Arthritis Foundation resources? And then what are some of the outside resources that can be really helpful? We just published a podcast just a few weeks ago on open enrollment that speaks heavily to some of the changes coming up in Medicare that we want to make sure people are aware of, and just all around how to kind of think about what the right type of health plan might be for you. So I definitely recommend checking that out. We also have a checklist. We have a couple of different kinds of checklists available if you just want like quick and easy. Okay, these are the things that I want to make sure of. My medications are covered. What tier are they covered on? What's the cost sharing? My providers in network. These kinds of things that are just important to check every time because networks do change. And then we always do this kind of what's new for 2020, well, in this case, 2026. Last year it was 2025, one pager, because we want to make sure that if there are some key things that are the most important to know going into next year, that we sort of let you know about that. So that resource is available on our website. And we'll go through some of the highlights in just a minute on my last slide. But the one other thing I would just highlight is this in the bottom right corner, the Medicare resource, state health insurance assistance programs. You may be aware of these, you may even have utilized them, but it's a resource that I want to make sure that all people are aware of, that in your state, and here's the website here, shiphelp.org, you can find these, we call them SHIP counselors in your state who you can call, and they can help walk you through all of the questions that you have. That is a free resource available to you. There are many others as well, and we do detail some of those in that podcast episode, and including in the show notes with some links. So definitely encourage you to check those out. Okay. Next slide. I apologize for how ugly this slide is. There are so many words on the screen, but I think it's important. And we did censor it just a little bit because there's so much more that we could have put on here. But I just wanted to kind of highlight some of the changes with both Medicare and health exchanges going into next year. You may already be well aware of these, especially if you are going through open enrollment or have already gone through it. But these are just some things to be mindful of. We found out, fairly recently that some of the premiums are going to be rising quite a bit in Medicare Part B. Here it gives the numbers there, an 11% increase. We're seeing that in Part D plans as well, are going up about 6%, which isn't completely out of the ordinary. But just in general, across the board, including with commercial insurance, we're seeing a lot higher premiums than we have in years past. And we know healthcare costs have been rising for a number of years. So that's certainly, unfortunately, not new to any of us. There is an out-of-pocket cap that went into effect this year. So you may be aware of this, but just in case, it was part of the Inflation Reduction Act, which this piece of it we heavily supported and had lobbied on for years to make sure there was a cap on out-of-pocket costs for those prescription drug Part D plans. That did go into effect this year. And they do have kind of a rate of inflation in which they can raise it a little bit each year. So for 2026, it's going to be $2,100 will be your maximum out of pocket. One thing that has been very underutilized is this Medicare prescription payment plan. You may or may not have heard of this. It has many names. None of them are great, but this is the more formal name. You might hear people refer to it as M3P or MP3 or smoothing. But essentially what it does, it's a program you can opt into, and it allows you to spread your cost over the entire plan year. So that $2,100 basically would be split up over the course of 12 months. So if you're on an expensive medication where you're sort of shouldering a lot of cost early on in the year, and you want to have the opportunity to spread that out over the plan year, that is a program available to you. This is the first year that we actually have data on it because it's the first year it's been in effect. And that's how we know that it's been really underutilized, which tells me that a lot of people don't know about it, or they're not sure if they could actually benefit from it. Again, there are many resources. We have some on our website, but Medicare.gov also has different calculators and different things you can play with to see if you would be likely to benefit from that program. It's not a separate drug program. It's just basically an administration program that allows you to just, again, administer those costs over the plan year. And then the other kind of really interesting thing that's brand new for 2026 is the first round of Medicare negotiated drug prices will go into effect. So this was also part of the Inflation Reduction Act, and there were 10 drugs in the initial round. Enbrel is one of them, which is why we wanted to kind of call it out, because that is, of course, a drug that treats several forms of arthritis. So the negotiated drug price will go into effect next year. Now, how that interacts with your actual cost sharing obligations is going to be very plan specific, but that's just something that we want to make sure people know. And then on the health exchanges, just out-of-pocket maximums will be $10,600. Minimum premiums are now in effect. So if you previously paid $0, there will now be at least a $5 a month kind of fee for that. You have to actively re-enroll instead of just having auto re-enrollment, which has been kind of the standard over the last 10 years now that the health exchanges have been online. And then some other kind of reporting things just to make sure that, any changes that kind of happen throughout the year, whether it's income, employment, et cetera, are just, kind of effectuated through. So those are some of the big changes. There are more. Again, that podcast and the What's New in 2026 one pager that's on our website go into a lot more detail, including with Medicaid, which also has a lot of big changes coming. Okay, I believe that is the last slide for me, but I always want to make myself a resource. So please find me. My email is ahyde@arthritis.org. If you want to email me, if you have other questions, if you're not already an advocate and you would like to become one, I am at your service. Okay, Asia, back over to you.
Thank you so much. I want to say it was so wonderful to have you join us, Anna. I know that you and your team work so incredibly hard for us. It's in a busy time of the year, so thank you for joining. If I could have everyone that was a part of this presentation to come on camera so we can do a couple of Q&A questions. We are a little tight on time, so we won't have tons of them, but I do want to make sure that every single person from this presentation is able to answer a question that you guys submitted during registration. So the first question will go to Dr. Kreitenberg. How often should people with stable arthritis visit their rheumatologist as they age?
If you're already seeing a rheumatologist, then I assume that you already have an appropriate diagnosis. And what I mean by stable is stable medication, stable disease. You're not necessarily progressing. I'll typically recommend to see these patients, at least my preference, is every 6 months to a year, just to make sure all the questions are answered, the patient has a good understanding of what we're still dealing with, and so that I can kind of be on the lookout for anything that has progressed. Some people will prefer more frequent interaction. Some people prefer less frequent interaction. But the things that would make me want to see somebody more frequently is being on any medication that requires any sort of monitoring, like non-steroidal anti-inflammatories. And then if there's any questions that arise with regard to, any progression of deformities of their joints or new or different pain.
Wonderful. So we're going to go over to Harwanda. How does chronic pain or fatigue affect memory and concentration? And what do you think that people can do about it?
Wow. So chronic pain is a major thing that we have to deal with because when you're just not feeling good, you're not feeling good, and it affects every aspect of you. It affects your body, it affects how you perform, it affects how you communicate, it affects everything. And so, what I would recommend is that number one, we need to find out exactly what's going on, and you need to see if there is a treatment for it. So, since we're talking about arthritis, is there medication that you could take that would be able to help you with the pain? Is there something that you could do that would be able to help you with the pain? There are various forms and various things that can take place that would be able to assist you as you're moving forward. But once you can identify where the pain is, what the problem is, what the medication could possibly be, then you should be able to move forward and be able to address it in a standpoint of, okay, I'm not feeling good, but, and then you move forward from there. It's going to be there. You're going to have the pain. It's going to impact you, but if you can get the treatment for it, then that should be able to help you also to be able to move through your daily routine.
Wonderful answer. I'm going to go over to Anna. What is your favorite prescription saving program or resource?
Oh goodness, I don't have a single kind of one that I would recommend. All of the kind of programs have pros and cons to them, and they're very personal. So I guess my recommendation or my favorite suggestion would be to go on to some of those the resources that we have that do kind of hot link to some of them, but then also some of the other sources that I mentioned and that are on our website that can kind of guide you through some of that. And we know that something that's really becoming popular now are direct to consumer. So you might think of like the Mark Cuban Cost Plus. There's about to be a Trump RX platform that a lot of companies that, including Pfizer, announced they're going to sell arthritis drugs through that platform. That's a whole different kind of platform, and maybe someday we'll do a webinar just on that. But just a lot to kind of tease through, and it's going to be different for everyone what option is right for you.
Absolutely. And Jane, we are going to close out this Q&A with you. What better person? Leave us with your best advice about aging.
You've heard use it or lose it. Keep moving. Pick something that you love. Figure out how you're going to do it. Adapt. Just keep moving and keep positive. And I just wanted to say I facilitate a connect group. That's one of the most wonderful things the foundation has come up with to keep people connected to the information that the Arthritis Foundation has available as well as other people. And thank you for having me.
Jane, the pleasure is all ours. Thank you so much for joining us on this presentation. It is my hope that you are able to leave in good spirits, good body, good mind, and that when we send you that survey, you complete it. That's how we learn what to give you in terms of our resources. We have some upcoming webinars. So December 18th is going to be our last webinar for the year, Balancing Act Caregivers and Arthritis. So sometimes arthritis patients are parents. They're taking care of their parents, like Rwanda said. We want to make sure that you're taking care of yourself, prioritizing self-care as well. In January, Feel Like Yourself. That's going to be on Wednesday, January 21st. As we know about arthritis, sometimes it affects your hair, your skin, your joints, your weight. So much about your body can change with arthritis. And we wanted to spend some time at the top of the year to say, hey, you're great exactly how you are. Let's talk about ways to make you feel your best self there. And as Jane said, connect groups. That is a resource that we use so that you don't have to feel alone. Someone else on the call said, there is nothing that you're going through by yourself. All of us are living the exact same life, just at a different time period in a different space. A connect group can show you that. So our next meeting is actually tomorrow, and it is surviving the holidays with OA. That's one of the types that Dr. Kreitenberg talked about. And in December, we're going to be getting physical. We're going to have some kickboxing intervals on that one. That being said, I'm going to stop my screen so that you can see all of us close up. Thank you so much for joining us on this presentation. We hope that it was a great resource. When you get that survey, let us know what you want. Thank you so much and have a great rest of your night. Bye, guys.
Thank you.